are so happy to be here. Our data set was so exciting this year, so you're going to hear a good bit about that. So first, let me introduce our panel to you. You're going to hear from Dr. Wayne Mayfield. He's Research Associate at the Office of Social and Economic Data Analysis at the University of Missouri. Boy, that's a mouthful. Wayne has been with us from the beginning in all of our data sets. From the beginning, he does the analysis for us. So we are so happy Dr. Mayfield is here. Joellen Whitehead, on the far side, is Director of Data and Research for INCRO from Illinois. And Denise Mozzie she's a TA specialist for ELCTA and DAISY for the AEM Corporation. And both Joellen and Denise are in the capacity of being on the data committee. Joellen is the data committee chair, and Denise handled the majority of the data set coordination to try and get the data set together. So I'm going to start with a quote from Stephen Levitt, who's a famous economist. He says, "Data, I think, is one of the most powerful mechanisms for telling stories. I take a huge pile of data, I try to get it to tell stories. That's really what data is about. If you pull a whole bunch of data and it doesn't say anything, then there's no purpose for it. And I think we learned a good bit during this data pull in particular. You start with a theory, then you go in and you look at data and you try to prove your theory, and then you determine, does it prove your theory, does it not prove your theory, and what does it show you?" Our focus today, so we're going to talk about the findings from our new 2015 data set. We're going to compare those a little bit to our 2012 data set to see if anything changed, if there's trends. We're also going to look at it against the NCECE data, and then we're going to talk about a few featured analyses. Those of you that participated in the data set saw some test things this year that we hadn't done before, that we're going to feature some of the things that we found. Oh, how we've grown, as has Denise's goddaughter, who's featured in the picture here. Back in 2006, when we started this and we did our first data set, it was about 16,000 records, only a couple of states. Now, and then in 2012, we had 58,000 records. And I'm pleased to say that in this data set, we doubled and had over 120,000 records in the data set. That's a really large piece of data. What was in the data set? Well, who was in the data set? Let's start with who. So there were 9 PER-approved regional and state registries, and you can see them on screen: Connecticut, Illinois, Maine, Miami-Dade, Missouri, Montana, New Jersey, Oklahoma, and Wisconsin. And as I said, over 120,000 records, and those were people from over 22,000 different programs. Wayne's going to talk about representation a little bit when we get there, and saturation. What was included in the draw? So we had some new things this year, and we had some things we've had before. One of the new things was a longitudinal identifier. That's going to be really important as we move forward, because a longitudinal identifier allows this data set to set the precedent for more data sets and compare over time what happens. We can compare data over time with what we've done in the past, but not individuals. And that makes the longitudinal identifier will allow us to do that. There's demographic information: age, gender, race, ethnicity, employer information, regulation type, license capacity. Another few new fields were child care assistance funding, accreditation status, and some QRIS information that we asked for this year. All the employment information that we have typically asked: start date, hours a week, months a year, wage, title, age group. And then education information, not only highest level of education, but degree attainment information, both from the ECE perspective and the non-ECE perspective. And all of these frame the details of what we can compare. A few other things. This year we asked for some more credential information. We have asked in the past about CDA, but this year we asked states if they had other credentials: infant, toddler, preschool, and director credentials, and we have a little bit of data on that. We also asked about training hours. There's a lot of talk about training hours and core knowledge areas, particularly with the CCDBG areas coming out. And so we did some analysis by CKA hours. And then other information, we looked at experience, language, and then percentage of people that have CPR and first aid. Dr. Mayfield is now going to come up and talk to you about our findings. And this is a preliminary finding. So what you're going to see today is not what's going to be in the report completely. We're going to look at global numbers When the report comes out at the end of the year, there'll be a little bit more deep dive into the data set and into the different areas and by territory. So today you're going to see global numbers. And one other note I would like to make is after this session, those of you that participated in the study, we're going to have a session for you, and it's only for those people who participated in the data set, so that we can talk more about how the data set went, what we can do better, and then we can show you a little bit more of the deeper dive in your state data. But that is only for people who participated in the data set. Okay? So, Dr. Mayfield?
Thank you, Maria. Good morning. Okay, I did get that. That's good. There's enough early childhood people here to do that. First off, I would like to say thank you to all the states that did participate in this data set. I know it was a lot of effort, and partly because I had to go back and ask for additional data from some states, and I had to pull some more training data. So all of those people that helped to put together the data set, let's give them a big round of applause, because wouldn't be here if they didn't do that. And then I also would like to thank all the people that are part of the registry, because, you know, if we didn't have the professionals that work with families and children, we wouldn't be here doing this work. So thanks to them as well. I would like to start off, before I begin my first slides, I do want to note that the data, I'm going to be talking about quite a bit of data. Not all registries are able to be part of the data set across all elements, so they maybe don't gather certain kinds of things that the other registries do. And so some of the data that we are presenting will not necessarily include all the registries. I just wanted to put that out there first. So let's look at, you know, we've already talked about, and this is hard for me, by the way, because I'm used to like being right by my screen to look at it and point at it, and I can't do that. I don't even have a laser pointer, so I like to be interactive. It'll be hard just standing here, but I'll try to do my best here. But Maria's already talked about all the states and, all the registries that have participated, and you see them here. And this first slide basically looks at the employed actual registry participants, so who is employed in the registry, compared to what the Bureau of Labor Statistics estimates, their estimates on what the early childhood workforce looks like. We could spend a whole session talking about the issues with the Bureau of Labor Statistics, way that they look at child care and early education, but at least this gives us some numbers for people to figure out how many of the workers in your particular geographical region are you actually having participate, or what we like to call saturation. And this slide shows that. And so the first bar, a slightly less dark bar, gives you the actual number that are in the registry that were employed. And then the darker bar shows you what the BLS estimates the workforce is. And so a few things might first just jump out at you. Overall, we have, and I'm going to have to give some caveats on this, overall, between all the registries, we have about 65% of the workforce. The caveat here is Illinois, and I'm going to talk a little bit more about that, because Illinois, I sort of capped out at what the BLS said that they had, and Miami-Dade was not included because that they are a regional registry and these data are at the state level. So with those caveats, you see that we've got about 2/3 of people across all the registries, which is good, but we could potentially do even better. And I do want to take a little bit of a moment to discuss what was going on in Illinois. And I'll look at one of my panel members if I don't do this quite correctly, Joellen, who's from Illinois. But you know, when I asked Joellen, I said, look at that. You've got more people in your registry than it says that are actually working in the early childhood field. Your registry is doing awesome. It's recruiting everyone. And we talked about that, and we think that the Bureau of Labor Statistics does not adequately really capture the number of family child care homes that Illinois has, which is a very high number, as well as the number of assistant teachers that may be working in there. And so with those kinds of numbers, you see that that's the reason why they have, it looks like they have more people in the registry than what the BLS thinks is in there. But as I said, the BLS statistics have problems because of how they classify people, and they are working on that, and they're going to be changing those definitions. So I hope these numbers will mesh even more. But you can clearly see that we have a lot of registries that are doing quite well. And you can, particularly, I'm looking at Montana is doing well. Oklahoma has nearly everybody, and look at Wisconsin. And so we have some registries, and of course this differs by your policies, whether people are required to be part of your registries, but we certainly have a really good, I would say, saturation among these registries, and some registries have nearly full saturation. That's great. Now I want to talk a little bit about the programs and facilities. The vast majority, as you can see, are regulated. And so when we look at center-based programs, 94%, 93% of family child care homes, and about 85% of other program types. And we also asked, where do people work? And so in other words, where is your program located? And not surprisingly, but just to let you know, 86% of the programs are in fact in metropolitan areas. Now this slide, see, and I want to look at it instead of right here because I want to be with you, but that's okay. So this slide shows us just what the breakout is of programs and facilities in the data set. And the numbers are very nice and even. So 60% of them are family child care homes, 36% were centers, and 4% other programs. So that's sort of what the programs and facilities looked like. Now let's move to talking about the participants themselves. Now this is a this is a truncated slide. I say that because, as Maria alluded to, the report has much more detail. And in fact, we have far more what we call roles that we could look at. But we have now selected just some of the roles that are going to be most germane to the topics today. So as you can see across the top, center-based administrator, owner, center-based lead teacher, center-based assistant teacher, family child care owner administrator, and family child care assistant teacher. Family child care lead teacher was there, but there were so few of those, because most of those are usually the owners, that they did not include them. And we sometimes don't have a lot of data on our assistant teachers in family child care, so sometimes they will not be as part of the slides we talk about. But I wanted you all to see, of the early childhood workforce for the most part, what we have across registries. And you see you have a huge number, the total N across registries. We're not surprised that most of them are female. Although I found that interesting that in the family child care assistant teachers that number dipped quite a bit, and so I assumed that there were lots of husbands or partners or other people helping out that were male. That's great to see. I was actually slightly surprised by that number, and I think that's been increasing over time. And you can look at the race ethnicity across the different roles. And as you see, for at least 3 of our roles, we have a majority of white participants, but in our family child care, we see that, in fact, the whites are no longer the majority. We see a lot more diversity being represented with those participants. And as you can see, we have increasing numbers of Hispanic participants have been included in this data set, and more, as you all know, and throughout the country, it's an increasingly diverse country, and we see that the data and the people that are in the registries are becoming increasingly diverse as well. You see the median age there. One thing I'd like to highlight is that center-based lead teacher age seems to be going down over time, and you see that's a little bit lower than the assistant teacher, and we're not surprised that our administrators are, of course, slightly older. And then you can see the median years in the field. And so you can see that our administrators have been in the field for some time, but some of our other workers that are working directly with children are pretty new. 4 years for center-based lead teachers, 3 for assistant teachers, and 4 for family child care assistant teachers. So as you all know, this is a field that has a lot of turnover, and we can see that we don't have people that have necessarily been in the field for an incredibly long period of time, particularly those working directly with children. I'll just move along here. Sorry, and I gotta move my notes along here because otherwise I'm not gonna be able to keep up very well. I do next want to talk about trends in educational attainment, or what we like to call highest level of education. And so I talked about those roles. This slide breaks out for you what the highest educational level is by role. So you can see all the way over on the left, the center-based owners and administrators, and you see the different bars that represent the different degrees. And so starting all the way to the left with the dark sort of rust color bar is a high school diploma or less, and that was 29% for the center-based owner administrators. You can see 2% for the one-year certificate, 17% for the associate's degree, and 37% for the bachelor's degree, and 15% for the master's and or doctoral degree. And so that pattern is repeated for each of the roles, as you can see here. And what are some of the things that kind of jump out at us? Well, we're not surprised. Many research studies have shown that our center-based owners and administrators, as well as our center-based lead teachers, have more education than assistant teachers. But we have quite a stair step here, you can see. So about half, or over half of our center-based administrators have a bachelor's or a master's degree. It's 35% of our center-based lead teachers have a bachelor's or higher, and we're down to 16% of assistant teachers who have a bachelor's degree or higher. And there's been a lot of talk about the bachelor's degree being sort of a gold standard or a place where we would like to move people towards, and so that's why I'm highlighting that, as we can see, we still have a lot of people that do not have that particular educational degree. And of course, another way, the flip side of looking at that is the number of people that have a high school diploma or less. And you can see that that's less than a third of center-based administrators, but nearly half of center-based teachers, and more than 2/3 of our center-based assistant teachers. Now, one interesting thing to look at is to talk about, does education vary by the age group that you work exclusively with? And so those of you who may be familiar with the data, we ask the question about what age groups you work with. And this analysis basically, the people that said they worked across different age groups, they're not included in this. This analysis just includes people that work just with one age group. So we look at those who work just with infant toddlers, those who work just with preschoolers, and those who work just with school agers. And you can see what their education looks like. And here you can clearly see some differences based on the age group you work with. Those who work exclusively with infant toddlers, only about 1/4 of them have a BA or higher. Those who work with preschoolers only, about 1/2, right at 50%, have a bachelor's degree or higher. And then we look at school agers, it's kind of in between the infant toddlers and preschool rate, and that we have about 39% have a bachelor's degree or higher. So this clearly shows us that depending on and who you work with as far as children you are serving, that there are real differences that are occurring in the education levels. And I might argue, my background, I probably should have told you, I'm a psychologist by training and know a great deal about development. And I've always found it sort of sad that for our highest level of education, so people going to graduate school, you expect that you were going to have someone with a PhD teaching you how to do things. And even though that's when you have your most development, but when the people need the most help, when they're the very youngest, unfortunately, we don't have people with the highest educational qualifications working with them, and I think that's totally backwards. I think we should have the highest level with the young ones. And you know, once we get into graduate school, we certainly want to have a lot of good mentoring, but I do think that's something we need to seriously think about, is why are we just not valuing our infant toddlers in the same way? Now, some of us who have been with the Registry Alliance for a long time will know that we have been very interested in this concept of what we've called some college. So the idea that the highest level of education that someone achieves is not an actual formal degree, it's the fact that they're taking college courses, or perhaps they're working on an actual degree. And we have noted, or have had this idea at the Registry Alliance, that this has probably been, a big proportion of our workers. And I can tell you that that has been going up over time. Because in this last Dataset 2012, we really focused on center-based assistant teachers because they had the highest percentage of people that had some college. But look at this 2015 data set. We have, these are the, so you can see the roles at the bottom here, center-based owner administrator, all the way to family child care owner administrator. We have almost a quarter to nearly 1/3 of these participants have some college as their highest educational attainment. And so this isn't just a small number of people, folks. This is a great deal of our workforce. Now, those of you who work with registries know, yes, that's the case. And not all of the registries are currently gather information on how many credits are earned in college or are able to capture some college. And I would encourage you, if you don't do that now, that you might think about doing that, because you can see these are big numbers. And what I want to back them up against is that, so you remember we looked at the slide before that said what's the highest level of education. This is a slightly different slide in that, one, it's a different population, because this is the group of people that I can actually talk about some college. So if you actually would go back and compare the slides, there are different numbers here, because only registries that gather college credits could be part of this. But what I want to highlight here, the numbers are similar, by the way, is that if you look at some college, which is the darkest bar up there, you can see that in all cases, it's the second highest highest level of education category for all the roles shown. So it is an important factor when you look at educational attainment. And another thing that you can look at, if you have so many people that have some college, well, how many degrees, how many credits are we talking about? 1 credit, 3 credit, 5 credits? Folks, we're talking about a lot of credits. And again, those of you who work with the registries know that's true too. And looking at the data set, I think the maximum number was like 750 some odd credits. And I still like to tell the story. Those of you who have children that are in college or something, it's like, what are you doing with 750 college credits? Do you have 5 doctoral degrees? I mean, that's a lot of credits. And it's great because people are obviously trying to get a lot of education and learn more. But again, looking at this slide here, you can see, breaking it out by the number of college credits that people have here, that we have quite a bit of credits that are being attained by people. If you think of an AA degree as roughly 60 college credits, you can see that we have a lot of people that would have close to what we might think of as an equivalent. It's not the same having the college credits, you need an actual course of study, but we have a lot of people that might actually qualify for a degree. And you can see that assistant teachers are tending to earn a little bit more credits. Perhaps because they're working on a professional degree or a certificate or some sort of credential. And so we just see a slight, which I found interesting, tendency for our center-based assistant teachers to be the ones that are earning the most credits. Now I would like to move on to another very important outcome, as I like to talk about it, but wage data. And I want to tell a little bit of a story here because, you know, Maria said I've been here since the beginning, and in the beginning was 2006, we think, of the data for original. I'm looking at Denise. And so Maine, Wisconsin, Montana, and Missouri were the original that started out that particular, basically what formed the basis of what we're talking about today. But a year before that, in a basement of a little boutique hotel in Kansas City, was the first time that people actually came together and said, I've got some data, can we start putting it together? So that was 10 years ago in 2005. And I was there as well. And I would do much better at trying to crunch data on the fly now than I would 10 years ago, but it's still not a very easy thing to do. But I remember it was amazing. Even back then we had registries that were collecting wage data, and that was one of the important things to look at. And so I just want to highlight, like, we've been doing this a long time, and I think that's great. And those of you who aren't part of PER, please, let's be part of it. I'd love to talk about you in future data sets. Now, wages are extremely important. It's one of the things where we're really, as we talked about earlier, we need to be, well, I was talking about education, but education is obviously tied to wages. This is something that our field has been struggling with for a long time. And there you can see in this slide here what the median hourly wages are by role. And it's not surprising that our center-based administrators are making more than the center-based assistant teachers or lead or assistant teachers. However, those numbers are not incredibly high, 15, 1101, and 950. And in fact, in lots of places, for example, I believe in San Francisco, the minimum wage is just being raised to $15 an hour. And so in some cases, some of these people are really going to be affected by this, which is wonderful. They might make more money, but it is sad that the fact that we often have our workers that are making close to minimum wage at this point. I'd like to back these numbers up against some other kinds of figures, which I don't have a slide here, I'm going to have to talk about it. Kindergarten teachers, what do they make on average? $31 an hour, twice that of center-based administrators. Elementary teachers, by the way, at $33 an hour. That's according to NCES in 2012. So clearly, and of course, we're not talking about here people with bachelor's degree, we will talk about that, but clearly other fields that deal with children are making a lot more money than our own workers, and that can be a serious problem, as we know, with turnover. Another very fascinating thing that I want to talk about is that according to, let's see, some new research from Marcy White book, 46% of our early childhood professionals receive some form of government assistance. So it's like they earned income tax credit, we're talking TANF, SNAP, or the Child Health Insurance Program, CHIP. So nearly 1/2 of our workers receive some form of that or are in a family that does. That compares to 25% nationally just of the workforce. So clearly, as we know, we're one of those workforces that is not making enough money and has to rely on other forms and other resources to make ends meet. But yet we know we have people that are committed to working with children despite the fact that they are not making the money we believe they deserve. Okay, what was that? So let's look at what is the median hourly wage by role and highest level of education. Well, there you can see that broken out, and for the most part, you see for center-based administrators, lead teachers, and assistant teachers, we don't have really good data on family child care, or not as much as I would like, so we did not include them in this slide. You can see a nice stair step up based on their degree or their educational attainment. Although you see for assistant teachers, there isn't much of a stair step kind of beyond the associate's degree there. But it does, of course, go up from having no high school diploma or high school diploma. So we are not surprised that we see wage related to educational level, although it does get weaker as we look at center-based assistant teachers. What do people, I'm just going to sing out here, what do we think of these wage data?
Well, I think that even though there's a progression, I think that probably the issue that many of you are thinking about as you're looking at these data charts is that while it's stair steps, it's still not adequate. And so even though we're going in we have the right trend, the base is too low, and that we have a lot of work to do to think about how to adequately compensate the professionals in our field.
I want to, again, Marcy Whitebook, who works at the Center for the Study of Child Care Employment, has a great quote from the 1989 study of child care staffing. You may remember that. That was an amazing publication that highlighted the fact that the workforce was so undervalued and underpaid. And then they did an update of that just recently for the 25 years in 2014. But one of the quotes from 1989 that Marcy had that I think really is applicable here is that good quality care requires an environment that values adults as well as children. And folks, we can't be afraid to be valued here, and one way of being valued is having adequate compensation. Now, let me just give you a few other figures as you look at this, because, again, this is not necessarily a nationally representative sample. It is made up of our registries and from states that probably have overall less of a lower cost of living than the rest of the nation. And so according to the National Survey of Early Childhood Education, center-based lead teachers with a bachelor's degree earn $17 an hour. And I'm going to talk a little bit more about the national survey and its representative, et cetera, but you see here we have $13 an hour. So it is a little bit different and a little bit lower. But again, I believe that's based on the fact that we don't, again, have all the states involved here and the differences that we see in how the cost of living in those states. So another question that people are often thinking about, wondering, and hoping that the answer is yes, does wage change based on degree attainment? And so here, this chart shows you those who work exclusively with infant toddlers, those who work exclusively with preschoolers, and those who work with school agers exclusively, and what their wages are, whether they have less than a bachelor's degree or a bachelor's degree or more. And you can see that getting at least a bachelor's degree or higher education really can make a difference. For the infant toddlers, it's a $2 difference. It's over $3.50, it's $3.66 for working with preschoolers and for those who work with preschoolers, and it's nearly $3 for those who work with school agers. So there definitely is a bump, and a pretty good bump for those who have degrees. And I should have pointed out that this is just looking at center-based lead teachers. Now, how do the 2015 data compare to the 2012 Alliance data draw, as well as the NCECE, so that's the National Survey of Early Childhood Education, or sometimes I want to say NCECE, but that's not a very nice way to say that, but do some people, maybe you use that at any rate. And I love these apples. I have to highlight this because Denise did this slide. Are these really apples to apples to apples? So first I want to talk a little bit about the differences between the Alliance data sets and what the NSECE data look like. So as we've been talking about, the Alliance data is made up of for those participating states, or I should say rather regions, as compared to the nationally representative sample that the National Survey was able to obtain. Another important difference is that for the Alliance, data must be verified for the most part. It's not self-report, which the National Survey looked at. So that's a really big deal. And as a psychologist, I know we used to talk about the term social desirability, if you all remember that from your psychology classes. And it's one of those things where it's like, I'm going to answer the way I think I should answer. And so in some ways, self-report has a lot of problems. As a psychologist, I'm always a little worried about that. And finally, really the biggest thing and why it's nationally representative and why we cannot say that the Alliance data are is because the NCECE data was based on, well, it was actually pretty complicated, but the data that we're talking about was based on a survey of providers, about 10,000 providers. And it was sent to people all over the United States. It was a sampling frame that was meant to capture the entire nation. It didn't necessarily and was not representative of any particular state. And so that's what we mean by random selection. So what they did, they went out to the state agencies or administrators and said, give me your lists of who's actually a licensed or license exempt or regulated programs, and then they started from there. So I would say that there are strengths of both types of things to look at. The one real downside I will say for the National Survey is that, and I'm going to talk a little bit later on, is that we all know this. As a nation, we can talk about things generally, but oh my gosh, particularly when we start talking about early childhood policy or other things, things matter at the state level or regional level. It really is important. And so I do not want to take away from the power of a nationally representative survey, but I also know that for you, your specific registry, sometimes things might be a little bit different. So how do the education data compare? So this is another way to look at how close is our current data with this NCECE study, and plus let's look at what we looked like 3 years ago when we did this. And you can see from this chart here that pretty much, we're awfully close with the 2015 data set to what the national survey shows. The national survey showed that 53% of the participants had any form of degree versus 47% in the 2015 Alliance data set. And you see that number has gone up with the states that we have. By the way, I should just say very quickly, in the 2012 Alliance, we had a lot of the same states that we talked about, but we had two different ones. So in the 2012, we had West Virginia and Wyoming. And then this year, sort of taking their place, were Oklahoma and Illinois. So that's kind of the difference. And then the other states remained, the other registries remained the same. And you can, we look across here, we can see that pretty much, I would argue, the National Survey and the 2015 Alliance data set are awfully similar with respect to education, but you do see more graduate professional degrees, about twice the rate. And by the way, that National Survey, that number of N equals 4,800, I believe that was their return rate from their 10,000 some odd. So not a bad return rate, but that's the numbers they had. And the estimated workforce in the United States is 1 million. So now let's start taking a look at this about age groups worked with. How do the data compare? How good are, how close are our Alliance data with this national survey? Well, as you can see, particularly with those working from birth to 3, it is very, very, very close. By the way, I want to talk about this. This looks at both center-based lead and assistant teachers. And it is, like I said, extremely close, with the national survey showing 64% have less than an associate's degree and 62% from the 2015 Alliance data, 22% with a bachelor's degree or higher, and 19%. And so you can see that I would argue that both data sets from the Alliance were very similar to the national survey, at least for those serving infants and toddlers. Now, there's a little bit more differences when we start looking at those teachers serving children ages 3 to 5. Again, it's very close and similar, but we see that in the Alliance data set that there are people with somewhat fewer degrees or high, don't have quite as high as educational attainment here, 41% with a bachelor's degree or higher compared to 45%. And you can see that in the 2012, it was quite a bit different here with this respect. Between 2012 and 2015, there were some differences there. But I would like to make the case that the national survey and the current 2015 Alliance data, at least with respect to education, are awfully darn close and can really give us a good idea. And it's possible, nearly apple to apple. Now, another topic that we addressed, actually starting the last data set, was wondering whether there was a correlation or some relationship between age, a professional, and their education level. This came about because Herzenberg, Price, and Bradley in 2005 published a study called Losing Ground in Early Childhood Education, Declining Workforce Qualifications in an Expanding Industry. And they were raising the alarm bells that our educational workforce seems to have fewer, educational qualifications. And that was a concern. In other words, particularly with our older workforce that had supposedly more degrees, they're going to retire soon. And we're going to be left with this workforce of people that don't have sufficient education. They're going to be taking over. And we could spend a whole session talking about how and why that came about, or that fear. And so we talked about last data set, let's see if we can look at this. And then we looked at it again in the data set this year. And so what I did was that I grouped professionals by age and role and looked at whether they attained an associate's or bachelor's degree. And I'll give you the punchline before I show you the slides, but it's just kind of easier that way. Overall, this hypothesis that our older professionals have substantially more education is not supported with these data. And this is one of those ideas where I would, and I'm glad we talked about earlier, the longitudinal identifier that we talked about, because what happens is that we're sort of comparing cohorts, and I would rather look at people over time to see, like, are you actually gaining more education? But we don't quite yet have that capability of doing that. So that's a caveat for this. But looking at this sort of cross-sectionally, as it were, we see that it is simply not the case that our older workers have higher educational qualifications. And here are the data. So the first chart you see there is with associate's degrees or higher, and the lighter bar is 2015, the darker bar is 2012. What I want to tell you is that if the hypothesis that our older workers had more education, then this chart would look very different. In other words, when you look at the bottom, the 55 to 64 and 65 plus, those bars should all be longer than the bars for the younger age groups. And in this case, you simply don't see that trend. And in fact, you see, if anything, particularly in the 2015 data set, it's our relative youngsters, our 25 to 34-year-olds are in fact leading the pack as far as the ones having the most, at least having an associate's degree or higher. And then hopping over to the bachelor's degree or higher, it's a very similar story. The 2015 data are the darker bar, 2012 are the lighter bar, and again, we would expect to see those bars at the bottom being longer than the bars up at the top, but that is not the case. Again, our 25 to 34-year-olds are leading the pack in gaining at least a bachelor's degree or more. By the way, I didn't mention that less than 25, they have the least amount of education. That's not a surprise, right? Because education is going to be related to your age over time, and it takes a while to get all your degrees attained. And for some of us, it may take all our lives. That's great. And get 750 credits. But I find this some good evidence that, in fact, we don't see that we are losing our most highly educated professionals. We're gaining a lot of professionals with some good education. But we don't know whether they're staying in the field, and we don't know what else they're doing. So that's, again, this longitudinal identifier is going to be really important. There's another more pernicious way I could sort of frame this. And I think it may have some validity here, although I would welcome people's feedback if they don't agree. But we also know that it's been a little hard to get jobs out there. Unemployment's been difficult, particularly when you're young and don't have a lot. And so I think those job-related pressures, employment pressures, are driving some of our younger people to actually increase their educational qualifications before they even enter the workforce. And so I wonder to what extent that's also driving some of those numbers for the younger people to be higher. Any comment from? Okay. And now I would like to turn this over to Denise Mozzie, who is going to discuss some interesting data with respect to director participation in registries.
So Maria began our session today talking about really trying to understand the story that the data tell us. And we take this seriously at the Alliance. Each year, we have different featured analysis. And so Wayne gave you updates on this Some College issue, which we kind of made a splash with several years ago. And then the continued review of whether or not our most educated professionals are exiting the field. So when we thought about the data set this year, we really challenged ourselves to think about how can we add more context to our data. So it's one thing for us to continue to look at the data and to report the average level of education, median level of income, for instance. But how do we begin to think about the questions or the challenges that we get back often from the research community to say, well, what kind of saturation do you have within your state? Can we really generalize based on the information that we have? And not only are we challenging ourselves to think about that overall as a population within states or within regions, but we're further challenging ourselves to think about what about saturation within programs? We have begun to look at more program variables. Maria shared with you the different variables that we've asked for, and we added some elements related to program characteristics that we've never asked for before. And our registries were very diligent in reaching out to their QRIS partners and asking for the current QRIS ratings for programs that were participating in registries, for seeking out the capacity to serve children from their licensing representatives, and asking for the status of child care assistance. So really
charging them to reach out and to look at the other state data that we could add into this data set to help provide some of that context. We got all that information in and we began to look at it. And we realized that we've got some additional work to do around these saturation pieces, particularly within program. If we're wanting to look at some of these analysis pieces, we've got to simply do a better job at making sure that we have more participation within early childhood programs so that we can then make those analyses happen in relation to those QRIS ratings and capacity and such. So the question that we asked ourselves and that we began to think about and wanted to share with you today is, does director participation, director registry participation yield higher participation by their staff members? So if you can get that director to participate, are we more likely to have more staff from their program actually participating? You know, for years, we have been referring to the director as the gatekeeper for their program. And what that simply means is that we know that directors interact with a lot of different organizations within their state. As we have more and more quality initiatives, it's really that director who makes the decision on whether or not they're going to participate in different things. And even if it is required through statute or through regulation that a program participates, the level of compliance that you have in that participation is often guided by that director's perception of the effort. So would you guys agree? Yeah, okay. And there are a lot of quality initiatives. Registries are just one of those. And, you know, we hear again and again from directors that the amount of paperwork that they have to complete is enormous. And so we're often, from a registry perspective, talking about how to decrease that paperwork burden and that we can help them to create some efficiencies. And I think the more and more that we can talk about building partnerships with directors, the more able we are to actually encourage them not only to participate, but to give them the tools to help their staff to participate. So we wanted to share, we've been using this graphic for some time at the Alliance as well, to help people understand the various pressures that directors really receive in relation to participation in their state quality initiatives and regulatory initiatives. And so you can imagine that the little person in the middle is a director with lots of question marks. And think about, on a day-to-day basis, if you were acting in a director capacity, and many of you I know in this room have served in that capacity before, but if you're a director and you're trying to keep in mind and keep everything straight, thinking, okay, so what does my QRIS initiative need in my state? Have I done all my paperwork? I know that we need so many professional development hours, and there are lots of online training providers, but do I even really understand which ones are approved? And if they're approved, how am I going to get the documentation from all of my staff? My staff need to meet certain credential requirements for licensing and for QRIS. Are all the trainings that my staff are attending or asking for funds to attend, are those trainers even approved so that my investment actually has a return in terms of the clock hours? Compensation programs, you know, for those programs that are lucky enough to be able to participate in compensation programs, they often come with requirements as well. Director approval, they often have to do additional pieces and provide ongoing documentation for the maintenance of that approval. Directors are required to participate in many of the scholarship programs for their staff. So if you look at, for instance, the TEACH model, it does require directors to be engaged in that process as well. And we all know the extent to which directors have to interact with licensing. And here we are, this next bubble in the day-to-day operations for a director. We are the registries, and we're asking those directors not only to participate and to provide all of their information, but we need to be thinking about how to encourage them and engage them in a conversation about why registry participation can help them create efficiencies so that their participation in all of those other bubbles circling around them on a daily basis, how we can decrease that burden and actually yield benefits for them. And so as we continue to consider this idea that we can actually provide a service to directors, it does require a shift. Because as registries, pretty traditionally, we've been thinking over time that our relationship is really a one-to-one, that we have individuals who sign up in registries and they sign that release statement and we discuss with that individual their information, and we're very, very protective of that information, and we should be.
But we also, in some ways, I think, have not fully considered how our relationship is not just one-to-one any longer. If we want that context of that program, it's actually one-to-one with the individual, and then also with appropriate release statement information included to allow you to interact with that director, but it's also recognizing that crucial role of the director as the gatekeeper for their program, and to really think about how to honor and recognize them as true partners in this process. Because if you've got a director who's got 20 staff, think about that, what an ally they can become, and increasing the participation. So before we actually answer the question for you on whether or not the director participation in the registry actually yielded an increased number of participants in the registry, let us first look to see how are we doing across the registries participating in this data draw this year. How did we really do in relation to saturation for directors for licensed programs? And so we're only focusing on those licensed programs because we have concrete information in terms of how many directors or administrators you would expect to see, right? So if you look at this chart, you'll see here, let's first talk about registry director saturation, and that would be the bar on the right-hand side for you. So basically what this looks at, it's when we're talking about registry director saturation, that is the number of directors in relation to the number of programs where we have at least one employee in the registry. So if we've got anybody in the registry, what is the likelihood of having that director participating? What evidence do we have of that participation? And you can see here across the registries participating, it ranges between 31% and 89%. And I think the thing we always have to keep in the back of our minds is that we have quite a few registries participating in our data set now who are mandatory. And so it's not surprising to see some of the higher numbers for states, for instance, like Oklahoma or Wisconsin or Illinois. But we've got a lot of really good things happening in the other states too that are more voluntary. When I look at the figures and we see, for instance, rates, Montana with a 72%. So the likelihood if an employment is going to show up in Montana, 72% of those programs actually have a director associated with them as well. So you're really seeing that they're doing a great job in interacting where you can see employment occurring. But when you take kind of a step back and you look at, okay, so those are just the programs that are showing employment in the registry, and you say, let's just look at the licensing list overall. Because as we said, we actually asked the registries contributing data. They have to also provide those numbers, those backdrop numbers in relation to the number of programs, so we can see how many programs are not interacting with the registry. I mean, the numbers look a little different in terms of the saturation for states, the director's participation in the registry and what kind of saturation we have. And it drops then from 14 to 83% versus 31 to 89. So the states that have mandatory participation, they're still hanging in there pretty strong, but it's the states that have voluntary participation where you're more likely to see a drop. However, I think that it still should be noted, though, that even for those voluntary participation registries, if you work in one of those registries, you know how hard you work on your recruitment. And so it's not to be discouraged if your percentages are not as high overall. Instead, it's, I think, a charge for you to be thinking about how to recruit even more directors so that you have a higher rate of saturation for participation overall. So for instance, Missouri is evidencing a 28% participation of overall for directors in their state listed in the licensing system. So they can take that 1/3 figure and start to set some measurable goals to say, in the next fiscal year, for instance, they may want to see a 10 or 15% increase in how they're going to achieve that. So then back to the question at hand. So we've got a really good sense of saturation. And the reason why this is important is because we want to talk about the impact of that director's participation on whether or not you get additional staff to participate. And before I switch to the next slide, I'm going to ask one of my good friends, I'm going to ask Libby to answer a quick question for me. So Libby, if you were to think about a program in Montana that had a capacity to serve children 21 to 40, how many teaching staff might you expect to be present in that program? I don't care. 21 to 40 kids. Don't overthink it. 4 to 6 people. Okay. And I wanted to ask that because truly, I mean, I think Libby's response was great, and I was expecting that she would probably do that. It does matter in relation to, are we talking infant toddlers, are we talking preschoolers? Because we know that matters with ratios. But keep in the back of your mind that thought in relation to, you're expecting about 4 to 6 teachers if you've got 41 to 60. Okay. All right, so we actually took a look at what is the median number of teaching staff by licensed capacity and director participation. Because what we cannot tell you as registries that we know definitely in this program they should have 10 staff, in this program they should have 20. All we can do is set some categories for the capacity and then allow you to be thinking about, okay, for the size, 41 to 60, I would expect generally that we might see 4 to 6 teachers. We also know, though, that may be 4 to 6 full-time, and you may have part-time staff in there as well, so you may see the number shifting and changing. So you kind of have to back into this conversation and think about these figures. But what this chart can show you is that when there is no director in the registry, that is what the bar on the left-hand side. When there's no director participating in the registry and you just have individual staff members finding their way to the registry and participating, we see pretty evenly that you have 1, 2, or 3 staff members participating regardless of the capacity. So it's very, very flat. But when you introduce the participation of the director in the registry as well, you start to see the trend, the upward trend that we would be expecting to see. So you know, going from 1, 3, 4, 7, 9, 13, all the way to 17. Now, is that to say that 17 staff for 151 plus capacity is sufficient? It's not. We would expect to see more staff than that participating. However, the upward trend is really promising, and what it does is it underscores for us the importance of the role of the director's participation, and that we really then charges us to be thinking about that one-to-one relationship with registry participants. Do we just stay one-to-one, or do we begin to broaden our perspective to be thinking about, yes, it's one-to-one, but we also have a responsibility to partner with that director, because the director is the one who's interacting with all of those quality initiatives, and they set the tone and the pace for their organization. And we want them to help set the pace so that we can continue to see a climb in the number of staff participating. And ultimately, that will allow us to do more advanced analyses so that we can be looking at QRIS rating, we can be looking at more information around regulation, child care assistance, accreditation status. We have the capacity to do some amazing sophisticated analyses, but we need to be thinking about how to increase saturation within programs in order to do so. So that's one kind of featured analyses that we want you to be thinking about. We're gonna share with you 2 more to get you thinking, and then at the end of that, we're gonna be opening up with some very specific questions about these featured analyses. So with that said, I'm going to turn it over to Joellen, who's gonna talk with you about CDAs.
Good morning. So I think Denise's description of our featured analyses on director participation in the registry has some really interesting policy implications. And as she was talking, I was thinking about the journey that Illinois is going through and kind of evolving from our one-to-one relationship directly with the participant and starting to expand our thinking about how we provide tools and resources to directors and the policy that goes along with appropriate release statements and being respectful of our providers' privacy. So I think that's a really interesting topic that I hope we have some time to discuss at the end of this session. I'm going to share with you some information about our analysis of the registry data from our Alliance dataset with respect to the Child Development Associate credential, or the CDA. So why is this important to us as Alliance members? Well, how many of you recognize the CDA in some way in your professional development system, whether it's gets people on the career lattice, you provide scholarship dollars to help people achieve their CDA. Probably most of the people in the room here. So the CDA is definitely a big part of our professional development systems. To borrow a quote from Valora Washington, I believe their marketing slogan is the CDA is the best first step. And that's the way they're promoting it. For a lot of folks that are entering into our field that may not have achieved the educational qualifications yet of degrees, a lot of them go through the CDA, and that's a starting point for them. It's also a very important descriptor to talk about our workforce qualifications. So not just the formal educational degrees that people have attained, but we also need to be able to talk about our workforce in terms of the credentials that they've attained as well. And finally, you'll see a slide in here that speaks specifically about the infant-toddler CDA and the preschool CDA and some wage data that we've analyzed. And I think this is really intriguing, just thinking about the infant-toddler workforce compared to the preschool age workforce. 62%, if you remember Wayne's slide, 62% of infant-toddler teaching staff have less than associate's degrees, compared to 41% of preschool age teachers. So just kind of think about that for context as we're looking at some of the CDA data. So the first question we wanted to ask is, what is the rate of saturation of providers with CDAs in our participating registries in the Alliance dataset? So we got information on the total number of individuals with the CDA in all of our participating states, and we will make the note again, Miami-Dade is not included in this because they're a regional registry. And then we looked at how many of those CDAs actually show up in our data set. And we found that there's a 26% saturation rate for the CDA. So if you think back to one of our opening slides that Wayne was sharing, we actually have a 65% saturation rate of who we would expect or like to be participating in our registry. So our saturation for CDA is quite a bit less than what we would hope it would be. And we have some theories, some different reasons we can think of why this might be. It's possible that some states may not include the CDA as part of their career lattice, so participants aren't reporting that they have CDAs. Another possibility is we know people have their CDA as well as degrees, so associate's degrees or bachelor's degrees. And so if you're collecting the highest level of education, people may not report that they have a CDA if they have their bachelor's in ECE. So there are some theories we have about why this number looks lower than we might hope or expect. But I think the positive thing is that the Alliance has a relationship with the Council. And we're really hopeful that together we can work on some strategies that will help us have data that's more reflective of what we know is out there, and maybe even some data sharing agreements as well. So we're going to continue to pursue that partnership because we think this is a very important topic and one that we need and want to have some better data on. So this slide is about the percentage of providers who have a current CDA and early childhood specific degrees. So if you look to the left, the grouping, 5% of center-based administrators have a current CDA, and that's any type of CDA. And then we have 16% that have their associate's degree in ECE, 24% have that bachelor's degree in ECE, and 8% have a master's degree in ECE. One of the striking things I think about this slide as we were discussing the results and what it might mean, if you look across the board, across all 4 of those roles, you'll see that that current CDA percentage stays at 5%. And when I first saw the question, I kind of just in my head thought, well, as you get to roles that tend to have lower levels of education, I would expect to see the CDA make up a greater percentage. And we don't see that here. And I think that's really curious, and I don't know if we have any thoughts on what might be the reason, or if any of you do. Does anyone have a comment or theory on why that might be? It might just continue to be a puzzle. So I know this is something that we definitely want to keep looking at in future analyses. And again, hopefully our partnerships with the council will help us continue to get better and better data on CDA to see if this is really a trend that's going to be long-lasting, or if this is just kind of a interesting note about this data set alone. So next we wanted to take a deeper dive into the CDA and look at some of the specific CDA credentials and compare that to the wages that are being earned. So for the first analysis, we looked simply at our teaching staff, lead and assistant teachers, who work exclusively with infants and toddlers. And we looked at those that had their infant-toddler CDA and those that didn't, and looked at their wages to see, does that infant-toddler CDA make a difference in the average hourly wage? And for this analysis, and maybe Wayne, if you wouldn't mind, I could ask you to describe a little more about the analysis that you did.
Sure, not a problem. I love talking about statistics. Oh, well. Could bore you, a captive audience. No, as you can see here, there is an 86 cents difference, nearly a dollar difference, which is wonderful. But what I looked at here, and I do want to highlight that the numbers are a little bit small for the yes, it's only 303. And there were only 2 states that were able to provide data for this. They were Illinois and Montana. But this analysis looks a little more sophisticated than it does here. Basically, I won't go into it. It was an ANCOVA analysis of covariance. But what was really striking here is that when you just look at people of ECE-specific degrees and you're controlling for that, we do see this increase in wage, which is wonderful. What's not shown, and is one of those examples that I talked about why regional and state registries are important and not just aggregating data, is that this was not necessarily true for all the states. So there was an overall trend, but there were some states where we did not see this difference. And of course, we will be talking with these states later on in this session that Maria alluded to, but that's the sort of thing that you want to look at. Are you a registry that has this difference? So it may not be happening in your registry. But so I just wanted to highlight that. But that's so we controlled for a number of factors, and we still found this. But there was what we would call a significant interaction effect with, registry location. So just wanted to say that.
Thank you, Wayne. Yeah, I mean, it does look so simple on the slide, but I wanted to make sure Wayne had a chance to explain some of the analysis because I think it's very elegant and important, and it gives us a lot of confidence in our data. So bottom line, what we found was that for these infant-toddler teaching staff, the infant-toddler CDA, having that did significantly show that you would make a higher wage than if you did not have that infant-toddler CDA. So did the same hold true for those with a preschool CDA, working exclusively with preschool-age children? Any guesses? Yes? Quiet room. What do you think? What's that? Won't. Okay, well, 50-50 chance. Who's going to buy those raffle tickets, right? All right. So is the preschool CDA associated with higher wages? So Wayne ran that same wonderful ANCOVA analysis for the preschool CDA and those teaching staff that work exclusively with preschool-age children, and did not find any significant effect that having that preschool CDA made any difference in your median hourly wage. So we have a winner here. Better luck next time, Erin. Okay. So in the end, when the analysis was run, the most significant effects were found based on the location of the registry, meaning are you a member in Illinois' registry compared to Montana's registry? Not that that really means anything, simply where you live, but That's how the data worked out. And then education level, as we can expect. The higher levels of education that you have, the higher wages. Is there anything else you want to explain about that
Well, I was just going to say, and again, as the statistical language, a significant effect. But, basically, if you live in different states, you make higher wages depending on your cost of living, and that's exactly what we saw. And then, of course, as you alluded to, higher education was associated with higher wages, but not having the CDA.
Mm-hmm. Great. So before I turn it over, I believe Wayne is going to talk to us about the training hours by core knowledge areas. I just wanted to leave a parting thought. When I mentioned some of our disparities between the infant-toddler workforce and the preschool workforce and their levels of education, just kind of think again about this CDA data and how it makes a difference in wages, at least for our infant-toddler workforce. Think about what kind of policy implications that may have for your state, especially with some of the federal initiatives that are looking more toward the universal preschool and what it might mean if our most educated teachers are going more toward the preschool, the school-based preschool, knowing they're going to make higher wages. What does that mean for our infant-toddler workforce? So I think there's really some interesting data that we're going to want to continue to look at as we see national policy shift and move in different directions. So I'll turn it back over to Wayne to wrap us up.
As Wayne is getting up there as we switch around, I do have one thought on your question earlier about the CDA and early childhood degree, why that percentage is low. If the CDA truly is the first step, what could be happening is as people continue on to get degrees, they fall out of that, and so they don't then have current CDAs anymore, and then some people come in with current CDAs, so it's sort of one of those, it may be a rotating 5% of people, so that may be one thought in that area.
That'll be interesting. I was going to say that'll be interesting with our new longitudinal identifier to be able to look at that and see if that holds true.
Absolutely. All right. One more time with me here. So I'm going to be talking a little bit about training, and specifically about training by core knowledge areas as defined by the National Workforce Registry Alliance. How many people are familiar with the core knowledge areas? Okay, a lot of you, but some of you not. And I may have my panel help me with this because I was not part of necessarily coming up with these core knowledge areas. But my understanding about this, or maybe I'll just turn this over to Denise to talk about how were these core knowledge areas developed, Denise?
Well, I was thinking about historically, and I was noticing that Sarah Lemoyne is in the back of the room. And I believe was it Montana where we did the exercise? Yes, I'm looking to Libby. So in Montana, many years ago, we actually did an alignment exercise. Sarah facilitated that exercise where we mapped out all the registry staff, the different core knowledge areas. We decided upon the 7, and every state had to go up and align to start reaching some consensus. And then that process, that decision-making process, actually transitioned into the partnership eligibility review requirements. So every registry has to show how their alignment happens, regardless of how they do their own core knowledge areas in their state. They have to be able to align back to the National Registry Alliance, and those were decisions that were made by pretty much our entire membership at that point. We were much smaller back then, but the good work continued forward.
Okay. And by the way, that is so incredible. Training is something that we're focusing more and more on, and it is really important that we do that. It makes so much of our professional development is tied up in that. And so I think this was a wonderful step forward to actually provide a framework that all states, or excuse me, as I'm looking at Phyllis, all registries can work with. Even though I know it may be a little bit of pain because, for example, I know in Missouri they have 8 categories versus the 7 that you see here. And so what this chart represents, so CK is core knowledge areas. What core knowledge areas are represented in registry tracked training? And so across the bottom there, you see the 7 core knowledge areas: child growth and development, health, safety, and nutrition. I'm not going to read them all. You can see that. But all are important domains which training addresses. And what this simple chart shows is like what percentage of the participants that had valid training data actually said that they had that the training they participated in touched on one of these core knowledge areas. And what's striking here is that you can clearly see the most popular core knowledge areas, as it were, the ones that are most associated with training, were teaching and learning, health, safety and nutrition, and child growth and development. Those were the three big areas. What's interesting to note is that observing, documenting, and assessing family and community relationships, administrative and management were not very focused on by training across the states. And I think that actually poses a potential issue, particularly in my area. I also really am much about assessment and how important assessment is for driving children's development and learning, and it's sad to see that that was in fact the lowest percentage of all the core knowledge areas.
This is one of the areas that I think we came in with, if you remember the initial quote slide, is what story is it going to tell? And I think those of you that provided data, it was a struggle. This was a struggle for us as well, to try and figure out what do we want to find out. So what it boiled down to, at least on the first stage, was what core knowledge areas seem to be being reported. There are also a lot of other issues that came up regarding this kind of data, about how registries work and what gets reported, and whether somebody reports all of their training or only some of their training. And as we went deeper and tried to look at it by role, again, other levels of issues come up. Things like using college credit courses, which will convert to meet somebody's training hours. So it may make the numbers look lower, because if you took a college credit course, which converted, we didn't include it in the actual, what we called PD training hours. So this is just a starting point of what do we want to look at when it comes to people's professional development, and how do we want to look at it so that we can develop and influence policy over time, so that we can try and have a more common ground in this kind of thing. So it's a starting point.
Yes, I mean, this is a pretty brand new, yes?
I was just wondering, do you have the core knowledge areas in the core data element? So that
Yeah.
people are aware? Okay. Yes. Okay. Yes, thank you.
Actually, I should have let Denise say yes. She is more the expert, but I was thinking, yes, we And one of the reasons why I think this is really important, and for example, I am from Missouri, as you may know, it is the fact that I know that the registry doesn't necessarily know, or looking at our training calendar, are we doing a good job of trainings that cover all aspects of early care or any kind of care or education for no matter what the age group? And I don't think people think a lot about that. In fact, I hear complaints all the time in Missouri, it's the same training over and over again, probably in teaching and learning and health and safety and nutrition. And so it's like these kind of data can be used not only at aggregating together at a national level, but in your own registry to start talking about, are we really addressing all the areas that need to be addressed, in an equitable kind of fashion? And clearly, these are new data elements, and when we get more data, we can draw better conclusions. But the initial conclusions are like, we're kind of lopsided right now. So something for you to think about in your own registries.
Well, and one of the things I was concerned about when we were looking at this analysis, I was in my back of my mind, I was thinking, yeah, but we struggle in so many states. You hear the discussion around how many core knowledge areas can even be selected for a 1 or 2 hour training. And I know that more and more states are putting limitations on those. And so I was expecting to see a more even spread because of the tendency to say that you can cover all, some trainers think they can cover all 7 in 45 minutes. But we know that that's not the case, and so many states are starting to limit it, and I think you could see that happening in the data. And I think that's an ongoing piece of conversation as well. So, and do we have a question?
I was just going to say, whether it would be capping all 7 minutes, but whether it would be with that teaching and learning, maybe we're doing our job so well to embed observing and assessing, that maybe some of that is in there.
You have a great point. So they may be touching on observation and assessment in some form or fashion within that teaching and learning. Absolutely.
I think that's where some of the struggle too is, as we start to develop these data elements, it's having a definition so that everybody codes the same way. Because you're right, in some states you may say we only need primary core knowledge area, and if you cover some other things. In other states, they may say we want them all coded and we want them put in with the percentage that the course covers, and you can go from soup to nuts. This also really bridges into, as we start to talk about badging, combinations of things that create badges. So all of this kind of comes up in why we are even starting to look at this topic.
That we consider, there's so much emphasis on what impacts child outcomes. So as we start teasing these pieces apart, I think it's even going to be more important to be cognizant, aware, and understand what kinds of implications various pieces of training are having on our workforce to potentially affect child outcomes. Because as more and more, in terms of our accountability, if how we're using those resources is going to make a difference.
Absolutely. So we've thrown a lot at you, and we have left plenty of time for discussion, and we've got a couple of spark questions, what we're calling spark questions, that we want to offer an opportunity to have some discussion around. And Maria is going to play Vanna with the microphone today. So let's start with one of the first questions we want to pose to the audience. What strategies can you use in your states or regions to increase participation by directors? Based on what you've heard today, are you reprioritizing potentially that relationship with the director, and what strategies come to mind and how you might be able to do that? Mary.
In New Jersey, we run a leadership track where we offer, I would say, quarterly topics on professionalism and leadership. And my first thought when you talked about that was opening sessions just for directors who were in the registry and offering them regularly so it would be valuable to them to join the registry. So that's something I think we could implement pretty quickly.
Excellent. And if you could say your name and state also, I think that would be helpful. So that was Mary from New Jersey.
I'm Micah. I'm from Georgia, formerly from Arkansas, so kind of going to talk both sides of it here. I think really the biggest thing you can do, and we haven't built it yet in Georgia, and it's not released yet in Arkansas, but is to really make it to where the directors are like, this makes my job easier. Building that platform where they can get a snapshot of this is how many hours my staff have. This is the level they are in the registry. Where, what date were their last, criminal record checks done? Getting a snapshot of those things where they can bring it up and say, oh my gosh, I've got to get her to training, or yes, this helps me. I know I've got to re-up those background checks. If a director has that in front of them, and it's a director that wants to maintain compliance, and I think that's a key there, then they're going to say, that is a huge help, and why would I not use it? I can very easily see all of you there. Yes, I want you in there so I can pull all of that and get that snapshot. But we're also lucky that, it's housed in the state agency, so.
Yeah. So really focusing on those reporting tools for directors, okay?
Panu Lucier from Alaska, the Alaska Seed Registry. So one of the strategies we've used is to really try to get directors for us to go out to a program by getting in the buy-in of the director to give a presentation at their in-service or their staff meetings, and then give a presentation to the whole staff, and tying it to other benefits like the wage compensation program if we're in Anchorage. Saying that the wage compensation not only helps the individual professionals in the field, but it helps the entire program. It increases retention, and they can't afford to increase wages, so we're doing it for them. So those are a couple of things that we've used to get. We also encourage programs to include the seed registry application or the information on our portal in their hiring packets.
Excellent. Any other questions or comments, stories to share in relation to the director participation? Let me ask you this, though. For the states that are not participating in the data set, how many of you are going to go home and run the numbers for your directors on saturation? I see a couple of hands. Okay.
I'm Erin from Iowa, and in our state, you can't link to a facility unless your director is already in the facility, so the Department of Human Services links the director, and then the director links all of their staff, so we would only see people linked to a child care facility with a role if the director was in. But I am going to go back to Iowa and send out some guidance information, some helpful hints on how to get their staff registered, and then show them the reports that we do have available in case there's been turnover that I haven't, that they haven't seen. So thanks for the ideas.
Excellent.
Let's do one more on.
Okay.
Yeah, just in listening to states, and I think it's South Dakota and/or Oregon get credit for this idea. They talked about really doing a 1 year, really a 6-month blitz around this, and going out to conferences, doing sessions for directors on how this will help you, having an honors wall, like along the conference hallway that said, here are the top centers for participation, and then having like a social corner where directors could sit down, there's an internet connection, and register on the spot.
So a very targeted recruitment strategy and plan, built in with a lot of recognition for their participation. Excellent. So we have one more. We'll take one more, Maria. We're softies. Yeah.
I'm Ellen from North Dakota. One question I have, and it came up at breakfast as well, was around that whole idea of the release of information. I'd like to know a lot more about that and know how other states are handling that.
So please come talk to us at conference, because on partnership eligibility review, we spend a lot of time working with states around the release of information and making sure that your participants are very aware with what you're doing with the data. So absolutely. The Alliance can definitely help states in relation to that. Okay, so let's move on. So we had 3 kind of hard-hitting topics. So let's talk then about what strategies you can use to increase participation by those who have a CDA or increase verification of CDA by current participants. So how can we really bolster that percentage and move beyond that 26% saturation within the data set, but knowing that it's also an issue for the states and regions not participating in the data set? So thoughts or strategies about how we can increase CDA verification or participation? We've got Jill over there.
Would be if we had a data exchange directly from the council, so that we would get automatic verification of every CDA that's reported. Because I think there's I think we struggle, and probably based on 26%, I think everybody is struggling with CDA verification apparently, and the best way to do that would be a direct from the council.
Okay.
Hi, I'm Katie Ryan from Kentucky. I just want to add to what was said. Absolutely, that's a huge part of it. I know that currently certificates that can be falsified are sent in, but the state's registry, which we go through a pretty intense process of verifying everything, is not automatically accepted, and that seems to be quite backwards. Because we often catch falsified records and certificates, So yeah, absolutely some advocacy on the end of state registries.
We're going to continue to do that. As we said, we have a new formal partnership with the council, and that's one of the things that we're working on, is trying to see if we can massage a better data transfer partnership.
Okay. Then we've got comment here and then here. Maria's going to get her steps today.
Well, my question would just be, what would the saturation level look like if you took off everybody that had already attained the associates, a bachelor's, or master's, and just looked at those lower pieces? What is the saturation level for just those?
I think that's an excellent question.
Yeah.
What's the saturation look like if you took it off those who actually had attained formal education? And we would need more discrete data from the council in order to do that. because we're looking at aggregate numbers reported from them by the geographic areas. And so I think that's one of the pieces that we're very cognizant that we would like to be able to take a look at. Because then it also then allows you to see for those individuals who have non-child-related degrees and have sought that pathway as well, so that they have more content in the field. So it gives you a little bit more flexibility. So yes, over on this side.
I guess I also just want to acknowledge that the CDA is weighted differently in different states' professional development
Absolutely.
Systems. So, for example, in Wisconsin, it's CDA is just not something that people pursue. It's very it's often a director at a program who had a good experience with the CDA that encourages their staff to do CDAs. In Wisconsin, there's just not a lot of people that get CDAs at all. So you're never gonna, if it's 5%, we've probably got all of our 5%.
Well, we're actually, in the after session for the states, we didn't call out those saturation rates. We'll be sharing those with the states, and our states have a lot of work to do. So there's a reason that we're at 26% saturation overall. We don't have any states that are hitting 80% or more in saturation for CDAs.
Right. I guess my point is that I don't know if people even have it in Wisconsin and aren't reporting it.
We know that from
Right.
the council now. We do know that. We can share that. Right, but the context.
Right.
Yes.
Right.
Yeah, absolutely. Yeah, so it's not showing up on all career ladders, and your point is really well taken. But we do see the push from other organizations, and for instance, Head Start has often been a major backer of the CDA. So.
I was thinking that you may want to look at saturation statewide rather than across all the.
Yes, absolutely. And we were trying to be very sensitive in terms of having a conversation with the states contributing before we release too much state-specific data. So yeah.
Hi, I'm Roz from Minnesota, and we're doing a couple things this current fiscal year in Minnesota. One is we are in our CDA applications, in our TEACH applications, and our retain applications, which are grants, to keep people in the field, we are awarding extra points for folks who have, first of all, you must be on the registry in order to receive any of those, and then secondly, extra points for folks who have a CDA, specifically infant toddler, but what we're doing is we're targeting people who have articulated or have a CDA that we want to help articulate into higher ed for TEACH grants, for TEACH scholarships. So what we're trying to do is use the CDA as a gateway to say, yes, you've done this and that's great. Now, building upon kind of what you're talking about in Wisconsin is, okay, so what, now what, right? So now let's take your CDA, get you some credits for it, and get you in the door into higher ed too.
Right, absolutely. That's a good point. And we've got one in the back. Brenda?
And I have a question about how you pulled the data. So I'm wondering about current CDA versus lapsed CDAs.
Oh, you're a woman after my heart. Yeah. So we actually, it has to be a current CDA, and they have to report the expiration. And we actually do it in multiple fields so we can cross-check to make sure that nothing that is expired is reported, because the council, by putting that expiration date on, we honor that, and so it's not valid in terms of our analyses if it's expired.
I would like to note, though, that some of the underreporting is possibly because some CDA data did not have expiration date, which we didn't take. So
Yes.
if you didn't have an expiration date in the system, they may be current, but we didn't know that, or you didn't report that, and so that may be a small percentage of the gap in.
So I know we have one additional Spark question, but unfortunately we are running out of time. But that said, I know that the training data discussion is woven throughout many sessions at the conference today. So you have an opportunity to continue that discussion. And so the message we want to leave with you today as we close out the session is not to be overwhelmed by all of this data, to keep calm and analyze data, because it really is a lot of fun in terms of the story that it can tell you and the messages you can take away.